Greetings, this is Advocates Global News for 2/22/2020, and this is news for the COVID-19 coronavirus and what the new numbers mean today. This is Baidu. Baidu is a Chinese search engine, among other things, and they have a page set up that I'll put in the description that tracks these numbers, and these numbers were just solely provided by people, and now they're approved by the Chinese government. So it's not every day that you look at this first page, or the top of the screen, and see 12 different numbers. Usually you see 6. But now it's giving us yesterday's numbers and the delta, the change between yesterday and today. So for example, confirmed diagnosis, which is actually diagnosed cases via a blood sample and a microscope. So that's either an electron microscope or a microscope the size of a Mack truck that says Nikon on the side. So you have to have a pretty powerful microscope to actually see a virus, because viruses are really small, and I know a few things about them because I studied them in the past. You can get a zillion viruses on a single human cell. That tells you how small they are. Anyways, that's confirmed cases 51,639 today. Now, cumulative cases at one point in January, when medical people in Wuhan, Hubei province, they were a little bit frustrated at not putting out good numbers because confirmed cases were way behind. Because why? Because people were going to hospitals and spending all day standing in line and waiting for the blood to be drawn, and sometimes it was a matter of a couple days before you got the results back. So somebody in Wuhan came up with a way of diagnosing cases without doing blood work and waiting in line all day, and that was to put you under a CT scan where they would look for actual effects on the body that were coronavirus related. So if you had if you had symptoms of coronavirus, and if you were exposed to somebody who was confirmed with coronavirus, then they would give you the scan, and they could tell within a few minutes whether you looked like you had coronavirus. So that's why there's a big difference between these numbers. One is blood confirmations, and the other one is blood confirmations plus other diagnostic ways to tell that you have coronavirus. So that's at 77,041 today, up 649 from yesterday, which is really a small number. We'll show you later. Then we have suspected cases, which is up 882 from yesterday, but that's still a really small number, almost unbelievably small number for all of China. Then we have cumulative cure, and cure is a little misleading because this does not mean that Chinese medical brilliance has cured almost 23,000 patients. Other sites call that recovered. People that most people, since the mortality rate is only 2.5%, most people don't die. Most people just get a little bit sick and they recover at home. So if you come to a hospital and they determine that you have, they diagnose you as having coronavirus, they might send you back home to be quarantined in your own flat or your own condo or your own house or whatever. And you could very well, get over the virus on your own, because it's just, to most people, it's just like another flu, because coronavirus is actually a flu virus. And this isn't the first coronavirus that we've seen on the planet. It's just a new one. Then existing severe, what that means, there's almost 11,000 people who are severe. That basically means in the ICU. So there's, people that are in really bad condition. So they could have pneumonia, not be able to breathe by themselves and be on a respirator. It could have affected their heart. Maybe they have a really weak heartbeat. They're barely hanging on. So these are people in intensive care, ICUs. And in cumulative death today, we're up to 2,445 deaths, up 97 from yesterday. So once again, usually when you look at this first page on this Baidu site, or the top of the page, I should say, without scrolling down, you see 6 numbers and you don't see yesterday's figures in there. And I'll show you what you see in just a minute. So here is a page from yesterday, and we see only 6 numbers. We don't see any changes. And what we see here is printed change data yesterday to be updated after the announcement of the National Health Commission. So the National Health Commission is a government body that has to approve these changes from yesterday and the numbers. So that's a little crazy, but that's the way it is. So usually when you look at this page, you see these 6 numbers. Sometime at the end of the day, China time, they'll put in the change numbers, and then they'll wipe out the delta numbers from yesterday to start the new day. So it's only for a few hours that you actually see the bigger screen, the numbers plus the changes from yesterday. And as you scroll down this Baidu page, the first thing you'll come to underneath that chart is a map of China, mainland China. And also they have been so good as to include the South China Sea and all of these Chinese islands that China claims, because we know that China was a seafaring country just like England and Spain and Portugal and all the European countries that sailed all over the world. China was doing the same thing, and that's why those are their islands. They don't belong to Vietnam or the Philippines. They belong to China. And some pipe dream. Then as you scroll down a little bit further, you see 2 graphs. This is the first one where you see in yellow added suspected cases for today, and in red new diagnosed cases for today. So as you see, we're up 649 as far as diagnosed cases, and up 882 for suspected cases. And that's one of them is up from yesterday, this 649, because yesterday it was under 400 for the first time since January. That was a really low number yesterday, with only 399 new cases in China. And this is a graph that shows you 3 different things: non-Hubei province and Hubei province and national China. So in gold you'll see the outside of Hubei province, and in pink is Hubei, and national, all across China is in red. And you can tell by looking at this that, Hubei being the epicenter and the place where everything is happening, where most cases are, most deaths are, most recoveries are. It's so big in Hubei province that it impacts, all of China. The impact is almost identical to the impact on China. Then as you scroll down a little bit further, you see a list of provinces, and it's usually defaults to Hubei province, and it's open and all the cities are underneath. So if you click on that little downward arrow next to it, you'll close Hubei province and you'll see all the other provinces. So today we see a couple of alarming numbers here, because typically outside of Hubei, the provinces are, like 1 to 5 deaths every day. And we see 2 numbers jumping out, 19 in Henan and 12 in Heilongjiang province. Heilongjiang. Every time I see that, I want to say it the old way that I used to say it, which is wrong. So I have to catch myself. Heilongjiang province, which is the province where Harbin is, the ice festival city. And if you scroll down further, you'll see some search results for the day. So keep in mind, Baidu is like a search engine, and they can track the top searches for the day. And the number one thing is always, what's going on with coronavirus, new pneumonia, whatever, they all lump that under, real-time dynamics. So that is people searching for what we just saw up above, the charts and the graphs and stuff like that. Then I tried to find some other articles that would be interesting. Guangyuan citizens take off their masks and drink tea. I looked that up and there wasn't much interesting going on. I'm not sure where Guangyuan is. It's probably in Guangdong province, which is where Guangzhou is, and also Shenzhen. So those are two huge cities, two of the biggest cities in China. Two of the top 5 are in Guangdong province, and this is not one of them. And another big city would be Dongguan. The ghost city is kind of in between those two. So this, I don't know where this is. And what else do we have here that I looked at? I wondered what this is. Number 5. 2 women were ripped off, masked man punched hit. So these are just a bunch of search terms that people use to try to find the same story. And this is kind of insane. It's probably viral in China right now. But what happened here, for some reason, there's people in a supermarket. Now, basically, all the Chinese towns are still shut down. But you can't, like in Beijing, there's a rule now that only one person from one family can go out every 2 days to go shopping. But, that's probably defined as going outside of your building. Now, I've lived in high-rises in China, and usually, the high-rises are really nice. They're beautiful, really well done. The craftsmanship is outstanding, and the materials inside of your flat inside of your condo would be marble. They look like the inside of a bank. So really nice places. But usually you only have to go down to the first floor of your high-rise, and sometimes the entire first floor is an open-air market, and sometimes it's not, and it has interior rooms, and the places around the exterior are smaller shops. So that's what you see is like, either it's one big market, that has meat and fish and, poultry and vegetables and fruit and everything you might need all in one big area down on, on the first floor of your building. Or you have to walk around the outside of the building and see all these different little shops, and there might be some little restaurants in there too. So in Beijing right now, there's a mandate that one person out of your family can leave every other day, and I think that mostly refers to not going downstairs, but getting in your car or getting on your bicycle and having to go somewhere, like to a drugstore to buy some masks or some drugs or some hand sanitizer or something like that. So anyways, this market, for some reason, there was a man at the checkout counter, and 2 ladies decided to rip off his mask, and he really got mad, and probably most people would get mad, but this guy went crazy. I have his screen print. Let's take a look at that. So this is, there's some bloodier pictures here. I didn't want to capture one of those. This lady that's closest to you in the white coat, she was one that ripped off this guy's mask. And this guy just laid into her, and he's like a big guy, and not only is he big, he knows how to box, because, most people that would hit somebody would just, give them a jab in the face or something like that. I work out with a big bag, and, jabs are okay, but to throw a right hook and a left hook takes some practice. Most people can't land a good right hook or a left hook, without any practice. It's just not a natural thing to do, to swing your arm sideways with enough power to put somebody down. And what this guy did is he just gave her right hook, left hook, right hook, left hook, 4 really quick punches, and he knows what he's doing. He just bloodied her face up really bad. So this is, it went viral, and the whole incident is being investigated. And, I would imagine that guy's going to wind up in prison somewhere, and the ladies are in the hospital. But, that's crazy. I can see getting mad for somebody ripping off your face, but off your mask, I mean, but, you don't kill the women for doing it. And this guy, like I said, he knows how to punch. He's like a boxer, or he works out in a gym or something. And not everybody works out in a gym works out with a big bag. So this guy really knows what he's doing. Then the other thing that I look at is coronavirus COVID-19. This is the name of that the nouveau coronavirus now. And this is by Johns Hopkins. And this is by a research institute. And I actually worked a little bit in a project at a research institute at Johns Hopkins. So there's research institutes that are affiliated with the hospital, which are funded by the AMA, American Medical Association. And then there are research institutes that are associated with Johns Hopkins University, which are funded by the university, by tuitions and stuff like that, and by private donations. So I don't really know which institute this is, but they maintain the site and they've been doing it for a long time. So this has been going on since early January. So right now we have total confirmed cases worldwide. This is a global thing. The Baidu is China only. This is global. And if you look down the list on the left, you can see mainland China is number 1, and then it has all other countries and the number of confirmed cases that they have. So right now we're showing 78,619. And the first thing I do is compare that with Baidu. So we can see the Baidu number is 77,041, and that's a difference of 750. So you would have to add that to the 76,291 to get the number that Baidu has. And then also you would have to add 750 to the Johns Hopkins total confirmed cases number, and that would give you 79,369 cases. So we're on the verge of 80,000 cases here today. Then on the right side you have total deaths and total recovered. And these are kind of crazy. Total recovered, that's a little bit more descriptive than the way Baidu puts it, because these people recover sometimes on their own, most of the time on their own. Of the 22,900 that are recovered, probably 21,000 recovered on their own without any medication. But if you scroll down both of these lists, you'll see provinces in China mixed in with provinces and states from other countries. So this is there's a scroll bar here. There's a scroll bar on the left too with all those countries, because they go down to countries that only have 1 or 2 cases. And on the right, the scroll bars go down, starts out with all the Chinese provinces because they have the most cases and the most deaths and the most recovered. But then you'll be scrolling down here to the bottom, and then you'll see California instead of the USA. So this is by province. Both these numbers on the right, total deaths and total recovered, are by provinces or states. And the total deaths right now, we're at 2,459 deaths worldwide. Then, I compare with yesterday, and I don't usually have to get 2 charts up here like I am displaying, because I know these numbers well enough to just know South Korea is just going crazy. And if you look on the left, 156, that was up from like 90, which was up from like 30, which was up from somewhere in the teens. All of a sudden, South Korea is going crazy. So why is South Korea going crazy? Because there's, one woman in South Korea who they say is a super spreader now, and she infected a lot of people. She's a member of this religious sect, which is a Christian, like a commune, which is something that is not condoned by any Christian churches in South Korea. It's like, Reverend Jones or whatever that guy was was it Africa or South America? But anyways, this is a big commune, a big Christian commune. And they have had a big event a week ago at this tall building, not like 6 or 8 story building, and there were 1,000 people in there. And they trace a lot of people are getting sick now, and hundreds of people are getting sick. 433 as of the 22nd in the United States. So that's why the South Korean number is jumping up. Is one person, infected over 40 people the first day, and now there's all these, people getting infected that are right around where that building is, or in the outskirts of that building, or medical people that treated people that were coming in because they were sick. So you get all these cases popping up now. Now this, I didn't really understand this, so I researched it a little bit, but this woman was never in China. But people in this town, what's the name of the town? Daegu. And Daegu is, on the opposite side of the country from Seoul. And it's, it's a smaller town, smaller city. And, people from that town know that people from this commune were going into China to recruit people. So that's the connection to China. It wasn't like people from Wuhan going on vacation in this crazy little town in South Korea. It's people from that crazy little town going into China to try to recruit people. So somebody got sick, they got that woman sick, and then she infected a lot of people. And also there was a clip on the news today, I think this is CNN, and this is a U.S. Army headquarters, which is just down the street, maybe 10 buildings from this big building where everybody was sick. But there's nobody in the U.S. headquarters. This is a big Army base, naturally. It'd be the headquarters for, South Korea. And there's nobody there that's infected right now, but this colonel was, giving the spiel on that today. Then we have Japan, which is growing every day, and the reason for that is, this Diamond Princess cruise ship that had, hundreds of cases, 600 cases on board, or I'm sorry, what was the number? 634, 600 something. So that is a Japanese ship, so naturally, as people are being repatriated out of the ship and back to their countries, there's a lot of people that are Japanese on this because it's a Japanese cruise ship. There's also a lot of Americans, like 100. So that's the number, that's why Japan is, rising up this list too. So we have 2 newcomer countries here at the top of the list. It used to be Hong Kong and Thailand, and now it's South Korea and Japan. And the reason they're popping up there is we just went over. Then we have another country moving up the list, and that's the United States. And the United States yesterday on the 21st was at 16, and that's up 2 from, the week before. We were at 14 for a long time, like 10 a week at least. And then we picked up number 15 in Texas, and then number 16 was a person in California again. So the reason that it's 35 today is because the U.S. sent in another one of these big military transport planes. It's converted to a coronavirus plane. And they picked up everybody, all the Americans from the cruise ship, and they're going to repatriate those back to the United States. So now the press was indicating that there were 45 confirmed U.S. cases on that ship, and apparently there's not that many because we're at 35 right now. And that's the reason that number is popping up, is these people have been taken out of the cruise ship and put back in the United States, so they're counting them in the United States numbers right now. Johns Hopkins is doing that. And the reason they're doing that is because the CDC. announced that they're doing that. So the CDC basically said that they're going to count victims now or confirmed cases in two different areas. One group would be people who are repatriated back to the United States, and the other group would be people who are from the United States and then went out and got sick, in Wuhan and came back. So I circled this in red. The 34 cases confirmed, and right now we're at 35, include 21 among repatriated individuals. So 21 of the 34 are people that we brought back into the United States, and 13 were, Americans. Then another country that's popping up this list is Italy now, and it went from like just a few to 20. In this article, if you look on the right, it says more than 70 people, and 2 have died in Italy. So these are, northern provinces in Italy, and there's really no good reason for them to be going crazy other than, Italy wasn't ready, and they had a couple of coronavirus cases, and it spread because they weren't prepared. So that's what's going on in Italy now. That's why that number is really big, and it says 20, but it says more than 70 infected. So that'll be going up the list, up above Hong Kong tomorrow, probably. So I'm just showing you some news articles that account for what the crazy differences are in these numbers. Then what we have, another spike that we have, that's all the countries that I wanted to talk about. But in total deaths, it's really, really unusual for deaths to be in pretty good sized numbers outside of Hubei province. And so we have Henan right here and Heilongjiang province that both have a big spike in the number of deaths. So 19 of these deaths come from an area where there's prisons, and this is a little bit crazy because, like I said, if you wanted to go grocery shopping, to get into a grocery store or a little shop, a fruit stand, to get in there's a policeman outside or a people's, army guy who is going to point a little thing at your forehead and take your temperature. And also he's going to make sure that you have a mask on. And once you're okay, you're allowed in the fruit stand to buy some fruit. So that's the way it is in every little shop and fruit stand in China. But the prisons weren't very well equipped. So I don't know, how this happened. They didn't even notice that they had a problem in the prisons until a lot of people started dying. And then they found out, hey, they got coronavirus. Then they thought, oh, wow, we got other people with coronavirus. They haven't died yet. So this is a little bit crazy that the prison system wasn't prepared. So over here on the right, you can see more than 500 inmates have been infected by the coronavirus in prisons across China. In Hubei province, 271 at the Wuhan Women's Prison. Then in Shandong province, 7 guards and 200 prisoners. So it's all over China now in various prisons where people, from Wuhan who went, everywhere else in China during the Chinese New Year's and went all over the world and infected everybody else. They also visited prisons, and that's why we've got coronavirus in prisons now, and that's why there's a spike in the number of deaths. Then we have a big spike in Harbin, which is crazy. So there's a bunch of areas of Harbin. Harbin is the ice city. It's like the coldest city in China. It's known for just being really cold. It's the largest, northernmost large city in China. So the capital, facing peak of the epidemic, their residents are saying authorities have been too slow to react on the outbreak. Well, as soon as I saw this Harbin and a big spike in deaths, I thought the ice festival. The ice festival started in December. And I always look that up every year. I look it up. Not, this year I wasn't going to go there. I'm not in China, but I always look it up. And when it first opened, which is in mid-December, I put out messages on WeChat and said, "Hey, people, if you're thinking about going to the big, international ice festival in Harbin, don't." The air has gone from, out, the air never is green in China, but it went out from the yellow to the orange to the red to the burgundy, and now it's in the purple. The air quality is over 600. You can't see buildings in front of you when it's 300, and it's 600 now. So why go to an ice festival when you can't see anything? So I put messages out on WeChat to my contact network and said, "Hey, don't, if you're thinking about going to the ice festival, don't." So that's no doubt how people started getting sick in Harbin, but nobody's saying that. It's just that, how would you get sick in Harbin? Well, because people from Wuhan visited Harbin. Now, why would they visit Harbin? There's an ice festival. It's like the biggest thing in China during the winter is the International Ice Festival. That's how people got there. And this is what it looks like if you look at the pictures on the left. It's like building a city inside of the city. This ice festival place is at some kind of public square, like a fairgrounds would be in the United States, and it's right in the center of Harbin. And there's a river running through Harbin, going basically east to west, but kind of diagonally. And right on the river bank is this big, huge ice festival. And it happens every year, and it turned color maybe 6 or 8 years ago. Before that, it was, everything was white, but it's still been an ice festival for a long time. So I tried to figure out, well, when did they close that? And I couldn't find any articles anywhere. I should have searched in Mandarin. But I did find one thing on this. If you see the bottom right here, it says Kids Post, China's biggest ice festival forced to close. And it says because of warm temperatures. Bull crap. This Kids Post is from the New York Post, and somebody that works for the New York Post got word from Harbin that the festival closed early due to warm temperatures. No, it was shut down by the government because public gatherings were banned, in mid-January. All public events, including Chinese New Year's. So that's why it got shut down. It wasn't shut down because of warm temperatures. There's always a few days where it's, warmer above freezing, and, it affects the ice festival a little bit. It might make the, ground that you walk on a little slippery. But I'm pretty sure this was closed down. It was closed down 10 days early. And by the way, this Kids Post here doesn't have a date on it anywhere in the article. So we don't really know what day this happened, but it said it closed 10 days early, and I think that it probably closed down in mid-January. Then on the lower right of the Johns Hopkins site, there's a little graph that you can click on the upper right corner of that graph, and it'll expand it. And I always take a look at these numbers, and I've been putting, these red lines in here. So we started out in late January to the end of January, kind of a linear progression. There's a number of cases every day, almost exactly linear. Then it got a little steeper. It started curving uphill, which is accelerating, and then it started curving down a little bit. But if you take that whole group of days, like 10 days, and put them together from February 1st to the 11th, excuse me, then you can basically draw one line through that and see, what's happening linearly. And that's just a little steeper line than the first line. So cases are increasing at a more rapid rate. During this period, the number of new cases was, typically like 3,800 a day, 3,800, 3,600 each day, and over 4,000 some days. So that's a pretty good rate of increase. Then I skipped 2 days because of the aberration in these numbers, the peak where they went from blood tests only to other ways of confirming cases. So I skipped those 2 days. There was just actually one day when Hubei province did that, and then I think the aberration the next day was other provinces in China following suit and including their other diagnosed tests as confirmed cases. So that number, starts out, or if you include, I just chose like 5 days, and that gives you a line, and that's going back to where it was kind of in late January, and then the latest day is even leveling off a little bit more. So in general, the number of new cases is leveling off a little bit. However, tomorrow we're probably going to see a spike because of, I looked ahead, it's the 22nd in the United States, but it's the 23rd in China and in parts of Europe. So Italy is going to be spiking. South Korea, Japan, there's a lot of numbers that are going to be going up. And the United States will increase a little bit too if some other people from that airplane get diagnosed and have to go into hospitals.